Welcome to In Session, the North Carolina Healthcare Association's podcast where we dive deep into critical issues impacting hospitals, patients, and the overall health of our communities.
I'm your host, Tatiana Kelly, Senior Vice President of Planning, Strategy, and Member Services. Today, we're tackling a major topic that's been top of mind for hospitals, our legislators, and North Carolinians, strengthening our healthcare workforce. North Carolina's population is growing and aging. According to NCHA's 2024 RTI Workforce Report, there were more than 5 working-age adults for every person 65 years old and older in North Carolina. But by 2035, there will be less than 3 working adults for every person 65 and older. Seniors will account for 20% of the state's population by then. The need for healthcare workers, especially registered nurses and physicians, to care for people across North Carolina is paramount. Our guest host today has seen the inner workings of building and maintaining a hospital workforce. Bernie Chudhansky is the Chief Medical Officer for First Health of the Carolinas, based in Pinehurst, North Carolina. Prior to her service here in North Carolina, Bernie served as Vice President of Human Resources for Northwestern Medicine in Chicago, where she provided strategic direction for human resources, workforce planning, HR and IT service delivery, and more. We're glad to have you with us today, Bernie.
Thank you so much, Tatiana. I'm so glad to join you today. This is a timely conversation as healthcare organizations across the nation are addressing those workforce needs and developing pipeline strategies.
That's awesome. Let's start with the big picture. We see the rising need for healthcare workers across the board, from nurses and physicians to non-clinical and support roles. Can you help us understand the current state of the healthcare workforce?
Absolutely. Right now, the vacancy rate for nursing positions have risen to over 10% in some areas, and rural hospitals are struggling even more to fill those critical positions. There are a few key factors behind this. First, as you mentioned, the aging population means more people need care, but many healthcare workers are also nearing retirement. Second focus, employee well-being, especially after the pandemic. At First Health, we are continuously evolving to better support the well-being of our team members. As part of that commitment, the Reed Center for Wellbeing was established, serving as a home for staff, providers, and community well-being resources. It's a comprehensive approach to support our First Health family with a wide range of services, including free counseling services for employees and household family members, deployable wellness, which provides on-site support tailored to the needs of our team members, and lunch and learns covering a variety of topics to foster growth and self-care. And then finally, there is a pipeline issue. We're not training enough new professionals fast enough to meet the demand, and it's those retirements as well.
So, Bernie, one way to address workforce shortages is what you just mentioned, by investing in education and partnerships. Can you give us some examples of what hospitals are doing to engage students and support those career pathways?
Hospitals are working closely with schools at every level. For example, many hospitals partner with middle and high schools to offer healthcare career expos and mentorship programs. Those initiatives spark early interest in the field and ensure students have the adequate prep and education for a future in healthcare. At First Health, the workforce development strategy begins with the Teddy Bear Fair for 6 and 7-year-olds. Teddy Bear Fair was originally offered to ease children's fears should they need to come visit us at the hospital, need to see a doctor, or ride in an ambulance. We have expanded to engage students with hands-on activities guided by our professionals. So this is their first introduction to healthcare careers. And then we have our 8th grade interactive healthcare career fair that builds awareness of healthcare careers prior to high school education track selections with hands-on activities with clinical and non-clinical professionals. This year, First Health hosted and introduced over 2,200 8th grade students to healthcare careers in 5 counties.
That's a fantastic way to engage younger folks. What about higher education?
Some community colleges and universities have also accelerated nursing and allied health programs and provide scholarships to reduce the financial burden. And then within our system, we launched an initiative in partnership with the foundation, our foundation of First Health, called First Futures. It's a career pipeline program where students apply for sponsorship and receive funding for education in nursing, allied health, or any other trade or program offered at our local community colleges that matches with a work opportunity at First Health. And then recently, we launched our initial apprenticeship program in partnership with Sandhills Community College and Apprenticeship NC. A program offers work-based programs with accredited classroom instruction. The apprenticeship model really cultivates the employer loyalty and trust in parallel with the students' increased skill and productivity. In this way, students gain confidence in a long-term career path while being a valued member of our First Health team. It ensures local students can develop healthcare careers here and remain to care for the communities we serve. Our First Futures Academy programs provide career development opportunities for our employees to advance their careers as well, including medical assistant, nursing assistant, paramedic, and medical lab technologist. We also offer job opportunities for high schoolers, job shadowing, teen volunteers, internships, hospital tours, tuition reimbursement. We also offer a speakers bureau comprised of our talented professionals, registered nurse residency for new grads, a mentorship program, and just so much more.
First Futures sounds like a great program. How can people that are interested get involved?
Students and adult learners can check it out and apply at firsthealth.org.
Wow, Bernie, you guys are doing so much. I can really tell that your system, as well as other hospitals, are really plugged into their communities. Some of the programs that you mentioned are organic steps towards strengthening that workforce pipeline for sure. I wanted to ask you about one of the joint initiatives that you and I have talked about over the last few months. NCHA also has resources for middle and high school students interested in those careers in healthcare. We developed something called idocarenc.org, and it's got tons of volunteer opportunities, resources, and a virtual career day program for students to check out and get inspired about all types of careers in healthcare. I want to also think about other folks within the workforce that may be looking for opportunities. Sometimes there are professionals changing careers, or even military spouses, or those that are matriculating out of the military that are looking to their local hospitals for job opportunities. Do you see that often, Bernie?
Yes, we do. We see that often, especially that First Health is close to Fort Bragg. Our military workforce pipeline continues to build with strong partnerships with partners such as our Hiring Our Heroes and Recruit Military. For military families, we recognize their unique experiences and offer tailored pathways to transition into healthcare careers. Jobs within hospitals offer stability, opportunity, and it truly is a community for military families. Our career changers, those second career individuals, they bring valuable and transferable skills to healthcare, and we invite them to apply for First Futures program as well to build their healthcare career.
So, Bernie, let's switch focus for just a little bit. We know that workplace safety is also a huge priority for our hospitals. What are you all doing to keep your workforce, patients, and community safe?
Unfortunately, workplace violence is a growing concern across the nation. Healthcare workers experience verbal and physical abuse at rates much higher than other industries. North Carolina has made progress, though. For example, recent laws increase penalties for assaulting healthcare workers. Just 1 year ago, First Health took a major step to strengthen our safety and security efforts by establishing our own company police department. On day one, our administrative director of public safety was sworn in as a chief of police, and today he leads a team of 15 sworn police officers and nearly 60 public safety officers system-wide. each playing a vital role in protecting our patients, staff, and visitors. This was more than a change in structure. It was a commitment to our safety and well-being of everyone in our facilities. In that spirit, the team rebranded as First Health Public Safety Department, reflecting their broad commitment to safety and security, as safety remains a top concern for healthcare workers everywhere. We are proud to have built a team of trained, qualified officers who understand the complexity of healthcare environments and are dedicated to keeping our people safe.
So, Bernie, on a more positive note, looking ahead, what are hospitals like yours doing now to prepare for the workforce of the future? What's your outlook on the healthcare workforce in the next 5 to 10 years?
We are focusing on innovation. Telehealth is creating new roles. We have data analytics are helping us predict staffing needs. Hospitals are also exploring to make healthcare careers more flexible and sustainable for workers. From a top level view, our aim is to work toward better patient outcomes, healthier families, and stronger local economies and communities. When hospitals thrive, communities thrive.
So, how can lawmakers and community leaders support all of these efforts?
By funding education programs, supporting workforce safety legislation, and promoting healthcare as a viable and rewarding career. Collaboration between hospitals and schools and policymakers is key to ensuring we meet future healthcare demands.
And I will also add that what's really important is by meeting those healthcare demands, we have really strong communities in which people can live, work, and thrive, right?
Absolutely.
Bernie, this has been such a wonderful discussion. Thank you so much for sharing your expertise.
Thank you for having me. It has been a pleasure.
Thanks for listening to In Session.